Welcome to Talk of the Town. It is Nurses Appreciation Week around the country, and we're at MiraSol Health celebrating a registered nurse, Erin Hanson. Congratulations.
Thank you.
It's
Thank
nice
you.
to be appreciated for your,
It is.
for
Thank
your
you.
great work. You've been a nurse, you said, for 9 years now.
9 years.
Been
Yeah.
here a little over a year.
Mm-hmm.
So what is the role of a nurse at MiraSol Health?
Well, I'm a hospice nurse here. I do admissions. I will go and do visits with the patients and families in their homes or if they're in a facility and provide supportive care.
Right. Now, why did you pick hospice nursing?
Well, it more picked me. I've done a lot of different types of nursing, school nursing, addiction nursing. Hospice nursing actually really fell into a good place for me as I've done behavioral nursing before. And I think there's a lot of components to that with the family, emotionally, spiritually. So,
Right. You want to share with us maybe a moment that makes it all worth it? It's a tough job.
it is hard. I did actually have a friend that was on with us, and I was able to participate in that end-of-life care. Challenging, but a rewarding experience to be a part of. So I was grateful.
I bet you have many special moments.
I do. It's hard to pick just one.
So it is a tough job,
Yeah.
and you have to take care of yourself. I
Yeah.
think nurses traditionally, they're always caring for other people,
They are.
but they don't care for themselves. So
Correct.
how do you care for yourself, and how does MiraSol Health support that?
Really, you need to sleep, you need to eat, exercise, those are important, but this organization also provides emotional support for its staff. So we do have a program that can assist them with that, and I think that's amazing. I don't think I'd seen it anywhere I'd been before. So
Yeah. So can you talk a little bit more about that emotional support and kind of what the needs are, what your needs are?
we deal with a lot of the grieving. We take on a lot of the emotional content that is in the home, and we provide some stability there. But when you leave, it can come with you, right? It kind of lingers on you a little bit. So it's important to have a good understanding of yourself emotionally and where you are, so that you can provide that support for them.
And what does Erin do? What do you do to
What do
stay
I
healthy?
do? What do I do? Well, I'm in school right now too, so I double duties.
And you're a singer, I heard. So you
I
sing.
had been. I do in the car now.
Okay.
But that's helpful. I go on trips. Going on drives is nice. You can just go through your thoughts. Cardio. That's how you deal with anxiety and stress. So I really push that and a good diet.
Very good. Now you, as a registered nurse, a hospice nurse, you're part of a big team, a great team, that you support each other and you work together and communicate. Talk a little bit about that.
Yeah, absolutely. That starts at intake, really, but then on admission, which I do those as well, we're really looking at evaluating the family. You know, if they need a medical social worker to come right in, I get in touch with them. If they need a chaplain for spiritual support, certified nurses, aides, nurses, volunteers. So we have a whole host of people, and we all work together and get together once a week to talk about the plan of care for patients. So.
And so you have that plan of care for a patient, but you also work with the families too.
Oh, yeah.
You're in those homes. So talk about that dynamic a little bit, Erin.
Initially, we start to start this relationship with these families of these patients, and then we have additional members of our team come in and have this relationship with them. We kind of grow together. That is how we work our plan of care. We take their hand in ours, essentially, and we help guide them through this process, because it really is a difficult one for most people. So, yeah.
And at the end of the day, when you go home, how do you feel after giving and giving?
It is rewarding, but it could be tiring. But again, you have to be able to, hospice nurses in itself, different from other nursing that I've experienced. So it's very important to have some self-awareness and some emotional intelligence so that you can manage that when you go home.
Okay, well, thank you so much for your service.
All right, thank you.
I know MiraSol Health is appreciative as well. And that's it for this edition of Talk of the Town. Thank you, Erin.
Thanks.